As you age, your teeth age too. Decay, fillings, trauma, or even just normal chewing habits can make your teeth break down over time. A dental crown, or a cap, is a cover that is placed over a tooth to protect a weakened tooth from further fracturing or deteriorating. A crown could also be used to replace a discolored or badly shaped tooth or protect a tooth that has had a root canal. Lastly, a new crown is necessary to simply replace an old worn-down or defective crown. It normally takes 2 visits for your dentist to complete your crown. On your first visit, a local anesthetic is administered to make the procedure more comfortable. During this visit, your dentist will use a dental handpiece to shape and prepare the tooth so the crown can properly fit over it. In some instances, the tooth may need an additional procedure to replace areas of decay or old fillings to better support the crown. Next, an impression of the tooth is taken and a temporary crown is inserted to protect the prepared tooth. This impression is then sent to a dental laboratory where a custom-fit permanent crown is made. In some cases, on your second visit, the permanent crown is placed and, if necessary, adjusted to create a proper fit. If the fit, shape, and color of the crown are satisfactory, your dentist will proceed with permanently cementing it into place. Keep in mind, in some instances, the crown received back from the laboratory may not fit as expected. In these cases, your dentist may need to take a second impression or readjust the tooth in order to fabricate a crown that fits just right. After the successful completion of the crown, it is not uncommon to feel some discomfort, mild pain when you chew, or sensitivity to temperature changes for a few days. As advised by your dentist, you can take over-the-counter pain medicine to alleviate the discomfort. If these symptoms persist more than a few days, visit your dentist. Finally, if your newly cemented crown feels too tall or your bite doesn't feel right, you should contact your dentist for further adjustment of the crown. You may ask yourself, can't I just get a filling instead? The answer is usually no. When a tooth requires a crown, it has already been weakened to the point that it may not be strong enough to support a filling. Using an unsupported filling instead of a crown often causes the tooth to fracture beyond the point of repair. Please keep in mind that the longevity and durability of your crown is directly related to your oral hygiene and the materials selected to make the crown. Porcelain fused to metal crowns have a porcelain exterior with a metal framework supporting it underneath. The porcelain gives you the desired aesthetic, and the metal framework provides better structural support, making the porcelain much stronger. This type of porcelain metal hybrid crown can be used to replace missing teeth in any area of the mouth, front or back. As a rule, the more precious metal or gold content in the metal, the better the fit, and better for the health of gums around the crown. An example of this great type of crown would be the captic crown. If you have any additional questions, please consult your dentist.